very panicky about getting this meeting started on time.
I bet. I bet.
That's a bummer.
Well, I'm awake. It got my heart started this morning.
I would think it would. Since you're kind of the master of ceremonies.
It is now 9 o'clock and the waiting room is currently cleared. It's starting to trickle in a little bit more. So I saw Steve, Adrian, Brandon, Casey, Kevin, and Kristen log in. Did I miss anyone?
Yeah, this is Van. I'm here.
Oh, Van,
Yeah,
I'm so
Van.
sorry.
Yeah.
You probably snuck in on me while I was looking down.
So that's a quorum, right?
1, 2, 3, 4. Yes, sir. So, and our waiting room is clear, so I'll turn it over to you.
All right, thank you. Appreciate it, Aaron. Just in case you're wondering, Aaron reported that Medicaid's had some kind of tech problem, right? So
Yes, we're having a little bit of connectivity issues.
So we lose it. That could be the explanation. Right. All right.
It's kind of crazy here, Steve. Mine's working fine. Amy's office is just next door, and hers is not working.
Well, hope we don't use Zoom. All right. I guess used to have traffic jams. Now we got other problems, right? So, all right. You have the agenda in front of you. We got a count. We did roll call. We have a quorum. We did not have a quorum in July, so we need to approve both the May and July minutes. I have a motion for that.
I'll do a motion. This is Kristen.
Kristen, do we have a second?
Yeah,
Brandon, second.
Second. All in favor, signal saying aye.
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 Those opposed and abstention. Approved. Very good. Glad we had a quorum. And I have on the agenda DMS updates. It may not be Leslie Hoffman, and that's okay, just so you know. I saw Angela on.
Hi, Steve. Yes, I'm here.
How are you?
I'm good. I apologize. Yes. So again, some of the technical issues, I am on a hot spot with limited service. So I'm going to keep camera off, so we can try to keep connection. But yes, did make it, wanted to provide some updates. I guess again, I will just start with some general Medicaid updates. If you all are have not heard again or aware of the Medicaid forums that are occurring across the state, I think there were a couple already in the last couple of weeks. through September, October, and I'll pull up the dates and maybe even 1st of November. So I can, again, Aaron, we can make sure we share that information if you all are interested in participating in any of the forums. Again, just to hear from our sister agency some updates, as well as Medicaid updates, and again, an opportunity to also connect with the managed care organizations. There will be present at the forums as well. So just wanted to make sure, if you haven't heard about those, we can get you that information and where the next ones are. So that again is in terms of DMS updates. We do again still have the monthly stakeholder engagement meeting, but with the forums over the next couple months, again, some of those might be rescheduled. But so for reentry update, again, lots of work occurring since our last meeting. Just a reminder to everybody, again, the implementation plan is due still to CMS at the end of October, October 30th. So that's about 6 weeks out. And again, there already has been quite a bit of work occurring and still to occur. So we did hold an Acres Advisory Committee meeting last week, which several of you all did attend. Again, during that meeting, it was a lot of information to share. We did not meet in the interim since our initial kickoff with the approval in trying to, again, get some of those work groups up and going. So we did just provide a high level preliminary gap analysis findings, which again really was driven out of the stakeholder engagement that we were conducting over the last several months. And again, to really support the mapping of the current state infrastructure, reentry services across the state, and then again, identify those gaps. So that stakeholder engagement again included focus groups, interviews, data requests, and certainly working sessions with our correctional partners. Again, we did meet with and collected data from various agencies. So individuals with lived experience was a focus group. We met with behavioral health providers. We met with MAP providers, with primary care providers and the primary care associations across the state. Again, our state agencies, Department for Public Health, AOC, Department for Aging and Independent Living, DCBS, and our managed care organizations. So again, we had conducted, like we had talked about, some initial stakeholder engagement, to support the drafting of the application. But this was really to get the full scope. So that wrapped up early this month. And again, Myers and Stauffer has been supporting us in terms of completing that gap analysis, which we just, the department did receive this week. So we will be reviewing that and again, providing some comments on that, and then also then be able to share the full analysis with everyone again in probably hopefully the next week or two. So and again, that will also lay out the current state, but we also want to provide our correctional partners an opportunity to review and ensure that we collected everything accurately as well. So that again is forthcoming. We have kicked off some of the core meetings with, again, Medicaid and our correctional partners. We meeting again bi-weekly, and then we'll have kind of a broader core meeting to include some of the other agencies as we kind of talk through some of the key decision points that we identified through the gap analysis. We are and have started meeting weekly work group sessions with DOC and DJJ. Again, those topics will change from week to week. do want to make sure again that we are transparent, that even though the implementation plan that we submit to CMS is still somewhat high level, we are continuing our implementation planning and work even after that submission. So again, the work is going to be ongoing through the next several months. And again, while CMS is reviewing that plan and we have some conversation and discussions and feedback. But so that work certainly is going to continue. And that's again where we'll really kind of get into the finer details that I know, we've all been anxious to do. Also, again, just some reminders. So obviously implementation plan is a large component. We will also then begin talking about monitoring and metrics and what our monitoring protocol will be. And so again, that is due to CMS at the end of November on the 29th. So some of the work group discussions again will be more focused around monitoring and metrics as well. And then again, we're also looking at then evaluation design that's due to CMS at the end of December. So again, that is an independent evaluator, and then needing to identify who that evaluator is going to be and bring them on board. So they will be responsible for drafting that design and that framework, again, to evaluate the state in terms of implementation in our progress. And then the state is also, again, required to submit that reinvestment plan, which is due to CMS at the end of December as well. And again, we've started some of that initial conversation about reinvestment and what the state would be required to reinvest. And so again, we feel like that the reinvestment dollars will be towards the 30-day supply of medication at the time the individual is released. But again, case management is a new service, and the MAT service again would be expanding those services in new and some present. So again, we feel like those two services would not require reinvestment, just the 30-day supply of medication. So we again,
can you explain, Angela, what exactly is the reinvestment plan?
So again, the state is required to reinvest the federal match that we would receive on any existing what the state or CMS would define would be already existing services provided by the correctional facilities that are covered under the demonstration. So each state again needs to look at the covered benefit package and services approved in the demonstration and determine which of those services are the correctional partners already again providing. So what's existing today. And then those are the services, the federal match that the state would receive on those services. The state is to reinvest those federal dollars into new services to support the reentry population and individuals, expand services. So for instance, if the state again is, if they're already providing MAT, for example, in some of the state prisons, but needs to expand to additional, and not even just state prisons, but any setting for, any state. The state can utilize those reinvestment dollars to support that expansion of that service. So it is the federal amount that the state would receive for existing services covered by the correctional facilities. So again, we believe our reinvestment plan initially will be on a smaller scale with a smaller set of services, and with only the 30-day supply of medication being that service that needs to be reinvested. So more to come on that. We are working with the correctional partners to get their formularies pharmacy formularies to compare with Medicaid's, also cost of medications that they're currently spending at the time individuals are released. And so that again is going to help give us a better projection of what that reinvestment cost is potentially.
And the
Then for us to
formulary,
be,
again,
okay.
not to interrupt, but I've people ask me about what formulary will be used. What does it look like? And I guess, you know, obviously DOC has a formulary, Medicaid has a formulary. There's going to be probably a lot of overlap, but will one prevail?
It will be Medicaid covering those medications at the time that the individual is released. So it will be Medicaid's formulary. What we need to do is compare that, right? To see if where the gaps are and what we would need to address if there's differences in what's currently being covered versus what Medicaid. But so that's the next
Okay.
step. Mm-hmm.
Have you looked at prescribing practices within DOC? I mean, the formulary is one thing, but what are the common medications prescribed most often or something?
Right. So I think that's the part of the next steps too, Steve, in, actually getting the data in terms of what is not just the cost, right? What are the medications that are, like you said, that the individual is leaving with currently. So we need to know what are the medications and the cost of the medications to do that analysis.
Yeah.
So again, hopefully we should have that information and to share next meeting.
Good deal.
Um,
And is this waiver population specific? I've gotten those questions as well. Is it everybody leaving?
So again, any adults in the state prisons are eligible for the will receive case management services. Well, are eligible for case management services. Again, we have to keep in mind, it's a choice.
Right.
And so they will all would be eligible for the case management services 60 days pre-release, and then up to 12 months post-release. And then for the individuals, only the MAT service, right? That's just specifically for individuals with substance use disorder. And that is a required service under the demonstration to participate. So only that service again would be specific to a population.
Okay.
And then all individuals will receive the 30-day supply of medication at the time. And the same is true for our youth population in the YDCs.
Okay.
Angela, if you don't mind me adding, Steve, just that way everyone remembers this is for prisons only right now,
Right.
not the jail population. Because I've had several people get confused on that. So I keep reminding people on meetings that I'm on of that factor too.
Right. I've been asked many times, what about state prisoners in jails?
Right. Yes, that's every single time. That's a question that I get asked. So yeah.
So it's really location specific, not,
not population necessarily.
Right.
And Angela, you correct me if you feel differently about that statement I just said.
No, that's correct. It is the setting, right? It is the facility. Yes, that's correct. So it is the state prisons as the facilities and the youth YDCs as the facilities. The individuals that would be Medicaid eligible if they were not placed in those facilities and settings. Correct.
And this should also address the issue we've talked about here before about getting on Medicaid they'll be on Medicaid pre-release, right? So that should be will it be assigned to an MCO pre-release?
Yes. So again, all individuals that would be incarcerated in a state prison, or again, that would be placed in a youth that would be placed in the YDCs. And they already are, right, being screened for Medicaid eligibility in that. So part, again, the large emphasis on in the project and program is to ensure that they are screened and determined if they meet Medicaid eligibility, so that again, they have that appropriate suspension at that time. And then again, at that 60-day pre-release time period, they already have, right, they've already been screened for eligibility, suspended. It is now reinstating that eligibility coverage for those pre-release services at the appropriate time. And so yes, they are given the opportunity, Steve, for the adults to select the managed care organization. And that again is part of the requirements and process, ensuring that they have information about Medicaid, what is Medicaid, what are, about the coverage, so that they can make those determinations. But for the youth, again, it would be the SKY program, and the SKY. So that
The
is
expectation is most will be Medicaid eligible, right?
yes.
Income for nothing else, right?
Right. So we want to ensure those that are not already, again, would be enrolled with Medicaid are afforded the opportunity to do that. And again, in the current state analysis and in the gap analysis, again, there's certainly opportunities for the state to enhance that, where they are already, our correctional partners are already, again, assisting with that. Medicaid, again, can have more of a role in that initial screening and eligibility process. But again, it is a manual process right now. And there's opportunities to ensure that we are incorporating that as more of a systematic type application process. And again, it eliminates some of those challenges and barriers in terms of backlog, if you will, and so forth. And so again, the systems component, the IT component is going to be very large scale in the demonstration, in addition to the health data exchange that needs to occur as well, which is very, very important for the case management service, that reentry coordination with our communities and our providers.
Is that going to be K-High?
That is, again, an opportunity for the state to look at. It's not been determined. That's part of, again, some of those key decisions and discussions that need to occur. Is that the platform that we can utilize as that universal health data exchange?
Yeah.
Mhm.
All right.
Anything else?
Yeah, any questions, folks? So it's not
This is-
population specific, it's setting specific. And the MAT is obviously only for SUD, but the case management service, which is pretty significant, right?
It
And-
is. It is.
You know,
Absolutely.
and
So again, the case management for all of the eligible individuals in those settings is to identify and, again, screen for those medical, behavioral health, and health related social needs. So it is that really, again, is going to drive the collaboration between our judicial systems and our healthcare systems and our communities, and ensuring, again, that we've identified holistically those needs pre-release, the plan to address them, right? So there may be some things that are not initially completed pre-release in terms of some of those services and needs. But that's, again, the goal, that we are establishing that plan and the connection and carrying that forward. And again, that smooth transition at release,
Yeah.
to continue to support them, again, long-term and ongoing.
Angela, this is probably too soon to ask, but do we have any plans for the MCO case managers to learn about what services are available through adult education in the state government, through probation and parole in state government, and some of the programs that we have that a case manager maybe should know about, to be able to refer clients to those?
Yeah, good question. And absolutely, Van, what we don't have, right, is we don't have those details yet. But that, again, part of the requirements under the demonstration is to ensure that we have that comprehensive community resource and, right, those state agency resources identified for the case managers, and that they receive training, and again, have that, again, those resources within the region that they may be in. And so those are the things that we, again, would want to incorporate into that case management assessment, right? Identifying what those needs are. So once those needs are identified, then we need to have the appropriate resources to refer them to, and that would include those agencies. And again, those are the things that, yes, need to be developed as a part of that service and
Very good.
process.
Very
Mhm.
good. Thank you.
And Van,
And
some of
we-
that work. Go ahead, Angela. I'm sorry.
Oh, that's okay. And so again, in conversation that we had with Dale, again, so our aging population, if you will, there's, you know,
Yeah.
certainly other populations to be included, but just as an example, they have lots of services, right, to support potentially those individuals. They're not always knowing, right, if they need those services. So ensuring, again, that we're looking at we're the demographics, the needs, and then again, developing that resource that in process, again, that case manager can refer them, are aware of what Dale's services are, can refer them to them, etc. And again, there's going to be some nuances, of course. Just in that example alone, in what they may or may not qualify for. But right, we want to develop that collective, and again, resource that all case managers would be able to access and utilize. And so is that, do we leverage Connect resources as that, that kind of go-to resource guide? And so again, those are the discussions we'll have to have over the next few months.
Yeah, it's not a coincidence that we're at the lowest recidivism rate we've had in many, many years, thanks to the reentry work that Kristen has done. But there's so much more going on right now with adult education and with Senate Bill 90, and
Yeah.
so many programs going on. It's hard to keep up with all of them for me. So I think it's important that we're all rowing in the same direction, and we're not duplicating services, and that's going to take a lot of coordination.
Yeah.
Absolutely. And again, I think that's why when we have these conversations, just the scope of the project is very large in terms of, and the impact, right? And these are the things that we can do without the waiver. However, again, the implementation planning, and again, having, kind of the coordination, like you said, Van, it's going to be important. And again, it's just going to support, the work moving forward that can, Kentucky can do. So many of the things we can do without, the waiver authority. really this is the opportunity that we can collectively come together and develop that plan and ensure that we're collaborating, like you said, statewide. So again, it's exciting that we have the opportunity to do that. And
Yeah, I think the case management is just a huge piece of all of this,
Right.
more so than the medication. But we want it to be as effective as it can be.
Yeah.
absolutely. And again, I think that goes back to, as we discussed the scope of the project, that's why it's really important in through the implementation planning that we are building that infrastructure that we can then build upon, right? And we can include additional services, we can include additional settings. We absolutely know those are the needs. But if we can, again, get these pieces of the puzzle, if you will, in place to begin with, it will be it's going to be such a large impact in itself. And then certainly, again, I feel like we'll be better situated to then expand.
Right. I think Senate Bill 90 in some counties have kind of done that same work, right, Van? I mean, there's, resources available. So, and it is 14 months of case management, right?
Right. And that's again why it's so important, and through when we talk about that stakeholder engagement and trying to collect, really again, identify the current state. That's why it's important. We are trying to reach all of the possible areas that we can to get the full scope and landscape of what is being done in Kentucky. And again, it's not necessarily to direct agencies and counties and how to implement their programs, but how can we utilize the demonstration to support their work? Can we again make it more streamlined? So that's really again what the work in when there's so much discussion around current state and gap analysis, that's why it's important. And that while we are really trying to collect all of that information and what is being done, because there is so much work being done, we do want to capture it so that we can really get that full picture and how we can, again, how the waiver might be able to support, the work that is being done. So
this is Greg from UHC. I love hearing about this project and this program. I also love hearing about the good things that are already happening for this population in Kentucky, some of the work that's been done. A couple things that I heard that are exciting to me. So things like making sure that we have good familiarity across the MCOs with what programs already exist. Kristen, we haven't met yet, but I see you nodding a lot on this topic. So maybe we could have some offline conversation around some of those things that
Absolutely.
exist. Okay.
Yes,
I would,
absolutely.
okay. So I'm going to put my email in the chat.
Perfect.
If you don't mind to reach out to me, that would be
Yeah.
great.
I will do that.
Okay. And then, Angela, the only other thing that comes to my mind, I know that we are at the very initial stages of this project, and we're still waiting on CMS for specifics. But I do think there's an opportunity for some MCO collaboration. I feel like we should probably get engaged and at the table for planning out how case management services will look, making sure that we are adequately staffed for that. So I don't know where the appropriate forum is to start consulting into this planning, but I do think it might be helpful.
hi, Greg. Yes, and thank you for saying that. So I think again, we do have kind of the DOC and DJJ work streams and work groups. Again, there may need to be, and this is what we're having discussion, even a kind of a separate MCO work group around case management, or again, we are pulling in, for instance, we had DCBS involved in the discussions with DOC and DJJ around the eligibility and screening process. And so again, do we pull the MCOs into those DOC and DJJ work groups when those we need to really focus on that service and that process? Or is it even just a separate work stream and an ongoing work group? So that's, I think, where we are. Greg absolutely is trying to decide and determine, do we, again, bring the MCOs in to the DOC and DJJ because those are separate, or does it just need to be a separate work group and then almost bring DOC and DJJ into those?
Right.
So yeah, I think that's absolutely, because we've got to have those discussions. Absolutely.
Yeah.
Perfect.
How many people, sorry, go ahead, Greg.
You go ahead, Steve. My bad.
How many people leave a prison a year?
So we have, between the prisons and jails, we do about 13,000 releases a year. And for the prison side, that's about 8,000 or so a year.
Wow.
We have a large population in the state of Kentucky. There's just a few.
Start hiring case managers now, Greg.
Right, exactly. Those are definitely discussions we want to have. We are on board with the heart behind this program. So we want to see these folks succeed as soon as they are transitioned out of incarceration. And I think case management can really help with that. So we're excited about it. Just want to learn more about how we practically implement. So I'm our operations person at the health plan. So I want to make sure that I understand how we're going to put some real clear policies around this and understand how we implement practically.
And I will just say, while we're kind of on the topic of case management, I think one thing that, we, through some of the working sessions, just trying to identify the current state and process. One thing around that we're really going to just developing the service and process is one thing, but then also really thinking through the individuals and just the state prison population, if they are released to a halfway house, and in which most are, I believe, right, Kristen. And so that is not, they may only be there temporarily, right? That is not their long-term housing. So connecting them to those initial resources and providers at that kind of more immediate discharge or release, time period. So there's those initial needs, but then there's those long-term. They may again move to another area within the state, and then again kind of then need to establish where those. So those are things that we're certainly around case management and the actual, when we're thinking of them initially releasing back into the community, where their initial release may not be the community that they are in, long term. And so it's almost a kind of a twofold, like an initial release plan, and then that case manager within, once they're kind of, I hate to say stable, if you will, but almost so, right? And then working on kind of the next phase long term. So.
And Kristen, I don't know this, but I think the length of time a person's been incarcerated would really impact the case management needs they may have, right?
Oh, absolutely. There are so many things that can impact that. The family support, the nature of the offense, their age. There's just a million things that can impact the needs, for sure.
Wow. I hadn't really thought about that.
Yeah. And I don't know, Steve, if you think it would be just helpful for this group as a whole. I am more than happy to meet individually with the MCOs that are wanting more information. But if you think it's helpful for this group as a whole to just have a meeting, like maybe on the next agenda for the Department of Corrections, to present a lot of the programs and stuff we are doing,
Yeah,
I'm more than happy to do that too. So however you
Yeah.
think would be
I think that's a good topic.
that works for me.
I I think that's a great idea. I think all the MCOs are interested, not just us. So I think the more that we speak collectively rather than individually, the better this program will work.
Absolutely.
All right, I'll give you as much time as you need. 3-4 hours.
You do not want to give me a microphone for that long, Steve. I promise. No, no. 45 minutes to an hour. We can get it all
That
in
could just
there.
be, that could be the next topic if that's okay with everybody. I think it's worthwhile.
No, I think that's a great idea because we certainly have learned a great deal from Kristen and our DOC partners. So, and it has been a great opportunity in learning. So I think there's
And if you know me, those of you that don't know me, I give it all. I don't sugarcoat it. So I'll tell you our gaps too, because we have them. I mean, we just do. Everyone needs to know our gaps too, because that's where our projects like this can help us fill our gaps. So.
All right.
By the same token, Steve, I think another topic for another meeting down the road would be the DJJ
Yes,
Yes.
to talk about their programs and their population.
I agree, Van.
because they're doing a lot of work as well, and certainly have, I think, some plans that they probably want to share down the road in terms of the work that they're wanting to do around reentry as well.
Very good. Any other questions for Angela? All right, thank you. Any hepatitis C update?
Not specifically. Again, I think that as when we kind of really get into talking about that case management services and what, some of those screening for services, how that can play in. We'll have to circle back with I think it was the primary care, some of our FQHCs, primary care centers applied for the HRSA grant. That was, again, to receive some funding to support these type of services pre-release. So that would be outside of reentry, right? But how we can, for those that potentially are awarded, how we can also incorporate that into the reentry planning. But I do need to circle back. I'm not sure when they were expected to hear any kind of notification on that.
All right, very good. Anything else? All right.
Sorry, I will just say, I do have to jump around 10. Christian Schroyer from Medicaid is still on if there's anything that comes up after that. But again, but appreciate the time and always feel free to reach out.
Yeah, good information. All right, MCO updates. Edna, Courtney.
Hey, good morning, everyone. I actually don't have a lot of updates, but I do see Kat Jones is on here. I wanted to give her an opportunity to update if she had anything she wanted to update.
Thanks, Courtney. I don't have anything for anyone this morning.
Okay. Yeah, I think we're still in the same boat. We're definitely anticipating what's happening, and we're excited about the opportunity to figure it all out. And then I know that Lana, our Start Strong reentry coordinator, has been working that program and of course attending as many sort of those statewide reentry meetings as possible and just doing the work. We're just preparing for what's to come.
For 8,000 people.
Yeah, not just a few.
Pretty cool, though.
It is.
All right, thanks. Anthem?
Hi, Steve. Good morning. This is David.
Hey there,
I'm
Ron. How are you?
doing well, doing well. A lot of great updates from the group today. Anthem continues to work with our reentry coordinators, our reentry councils across the Commonwealth, as well as coordinating our expungement clinics. Still a relatively low number of referrals, but we're looking forward to that increase soon.
Super. Appreciate it. Humana.
Good morning. This is Lynn with Humana, and our team is just continuing to be active and engaged in the reentry meetings and events throughout the state, just to, ensure and remain informed and connected amongst the activities that we have been participating in our coalition meetings. In August, we attended the KCIW, correctional meeting. We attended the Hardin County Detention meeting. And starting off in September, we attended the Western Kentucky Reentry meeting and looking forward to being a part of the Community Impact Council meeting held in Frankfurt. Going into October, we had a significant amount of events on our calendar, which include a couple of outreach tables that will allow our team to set up booths at the Maysville Hands of Hope on September the 25th and Neighbors Helping Neighbors on September the 26th. We will also be present at the Wellness Fair that will take place in Frenchburg at Job Corp. That'll be held on October the 1st, and we'll be partnering with Moorhead Goodwill for their Community Partner Day. We will wrap up October with an expungement and job resource fair that be held in Lexington that will allow the team to process some critical resources to those seeking expungement and reintegration support. So these events are part of our ongoing efforts to stay educated and engaged, as well as support our community. And we believe that these activities are vital to our mission and look forward to continuing our proactive engagement.
All right. Thank you, Lynn. Very good. Passport?
It's Mark. Good morning. Aaron, if it's okay, I'm going to share my screen because I don't think you want me to read all of this, if that's okay. Oh, I can't. Never mind.
Give me just a second. With the connectivity
right.
issues, everything's moving very
Oh, that's
slow.
okay. Yeah, and don't worry about it.
Okay, now you should be able to share now, hopefully.
Okay, so we've had 10 activities specific to DOC in the last quarter. Some of these might have been discussed at the July meeting, which I wasn't a part of, but we've sponsored 5 events, including 2 expungement clinics and then some reentry councils. We've participated in 5 other agency meetings that we did not sponsor, although some of those did take place at some of our one-stop shops across the state. We have 6 more events that will run through October, including one that I'm including from Monday because I don't have the numbers on it. And those are also a jail pre-release class in Butler County, as well as some more expungement clinics. These are all sponsored by our community engagement folks, including Priscilla Schwartz, who's on the call, in case you have other questions. The first 3 expungement clinics from July and August had a total of attendance of 148 folks, which are not just passport folks. Anyone can attend those. And so I think that's all I've got. I will stop sharing.
Thank you, Mark. Very good. There's a question. Is 8,000 people leaving state prisons, not total population, right?
Yes, that is correct. There are on average 13,000 releases from all locations. So that includes our jails. But the 8,000 number was specific, and that's of course on average. That's not an exact quote, but specific to our prisons.
Wow. And how many folks are in the DOC custody, roughly?
We have on average between 16 and 17,000, you know, depending on the day, of course, you know, it fluctuates. But I will say the recent passage of House Bill 5, changing sentencing structures and sentence credits, we are anticipating our incarceration numbers to rise a little bit. We are, if you look in, and you'll hear, you know, I'll say this when, of course, when I talk to everybody, but when you look at Kentucky in comparison to other states in the United States, we are high in comparison in incarceration rates. So we have high population rates in the state.
Okay. And that's 16 to 17,000. That's at DOC state prisons, right?
No, that
Total. Okay.
Yeah, in total, that'd be all of our locations. And then you have to think under the Kentucky Department of Corrections, we also encompass people on supervision in the community with probation or parole. They have approximately 50,000 people on supervision in the community.
Wow. Sure. Okay.
We have a big system.
Yes, you do. You do. All right. United is next up. Appreciate that information, Kristen.
Hi, good morning, Steve. It's Stephanie
Hey,
Koenig.
Stephanie, how are you?
Doing well. Thank you, Angela, for the updates. So we continue to do our enhanced reporting on a monthly basis. I know I've reported out on this previously in the TACs. We began this the beginning of the year to try to identify those. I will report we've not received any of the referrals from the pilot from DOC, but with our enhanced reporting to date, year to date, we've been able to identify 958 individuals reentering society from incarceration. Out of the 958, 148 of them were reached. We were able to complete 107 HRAs, and then 71 have agreed to case management. So those have been our outreach efforts. We also have continued our partnership with Goodwill. We do not have any scheduled, but continue support expungement clinics. We do have 3 upcoming community health fairs that will be tailored. We are sending out and doing active outreach to the locations for the reentry. So there'll be legal aid services available, as well as Hep C and HIV testing. And so those events will take place in October and November.
All right. Super. Thank you.
You're welcome.
All right. And WellCare, Centene.
Good morning to you, Chairman Shannon.
How desperate have we gotten, Stuart?
I give you the honor that you've earned it. You're the chairman, so got to give it to you. As we've talked about, I thought I'd give an update. We have WellCare has it's a community impact council. And we have different ones of these, but we got a particular one in Franklin County. The whole point of these councils is to identify community leaders in a given area, people that are SMEs on a given topic, identify a problem in the community that we want to collaborate and help improve, find some kind of solution for. And so anyway, we set this one up last year. It's for Franklin County reentry to society. And so it's the local jail. It's not the state prison system. And what's super cool is at least 3 other MCOs are on this council as well. And I don't think Lana from Aetna's on. She may have been on from the get-go. She's a wonderful participant with that. But anyway, this year we've been meeting. I've only been to a couple of meetings, but almost every month. And so at the last one in August, I was not there, but I've got notes. It has grown. We now have the council just at the last meeting alone added a couple people from the Franklin County Jail. They're actually on the council now. DOC, as somebody from the Division of Addiction Services that's on it. Somebody from the Franklin County Trial Office, somebody from Public Advocacy, new people from Probation and Parole, also the Franklin County Health Department Harm Reduction Program. All those are new people that joined at the last meeting. And there was a Friday, some of the members from the council met with the new jailer, Tracy Hopper, and staff. I don't know how that went, but that was last Friday, the new Franklin County jailer. So anyway, I mean, it's definitely cool. Obviously it's growing to get more people who actually can influence, and get something accomplished. And one of the things that one of the takeaways was, and I believe we got a response maybe even yesterday, but I haven't seen it. They were going to contact the Office of Vital Statistics about getting birth certificates, because it's a nominal fee, but it's still a fee. I mean, you've been released from incarceration, and anything is a problem. And I believe there was a response from the Office of Vital Statistics about what exactly would have to happen, what somebody would need. And they do have different even where it can be free based on certain criteria or something.
Hey, Stuart.
Yeah, go ahead.
I'll help you with some information
Yes.
that I can send you, because the Department of Corrections has been meeting with Vital Statistics, and the recent House bill passage that allows homeless, and I wish I was good enough to quote the number, but I'm not. So, but
But Adrian Bush knows the number.
I know, that's what I was gonna say. I don't know the number as I'm driving. But there was a recent passage that allows a homeless individual to receive a free birth certificate. So the Department of Corrections has been working with Vital Statistics to figure out what the definition of what our population, because we believe if they are coming out of incarceration and they have to go into a halfway house or something like that, that defines them as homeless because they have nowhere to live, obviously.
Right.
And Vital Statistics agrees with us. So we are setting up a process with them currently to get those birth certificates free of charge. So I'll get you some information. It won't be today because I literally have back-to-back meetings all day. So it won't be today, but it will probably be tomorrow. But I'll get you some information. We are still that is still in the works of us working everything out, but that'll help you out with that adventure.
That's some awesome news, Kristen. Thank you very much.
Absolutely.
Yeah,
Good way to start
it's a big
the day.
topic for people who are leaving. I hear they don't have a birth certificate, they don't have a Social Security card anymore, they don't have an ID, they can't get to work,
Yeah, and the MCOs, I mean, we pay for state ID, but that's for our members. It's a value-added benefit for our members, and other MCOs do too, but that's if you're a member, not just anybody.
Right.
And that's one of the things that the council has identified, and they're, keep looking at who can, ways to get some more funding and possibilities to do more stuff like that to get the state IDs. Somebody else who's on the council is a wonderful resource. It's Dennis Hall with DBHDID, Department of Behavioral Health, Intellectual Disabilities. He oversees a program. The acronym is SOAR. It's really long, the actual words, but it's for individuals who essentially qualify for disability, SSI or SSDI, and it's tried to address homelessness. And of course, a lot of there's mental illness or co-occurring with substance use disorder, which obviously that you have that prevalence, and so he oversees that. And I think I suspect that it's SAMHSA, SAMSHA, and I think it's probably a grant from them or something. But he's been providing information because that's obviously critical. You're released from jail or prison, and where are you going to go? So he's been a great resource for that. And so that's been a topic as well. And I know we've got community engagement coordinators like other MCOs are out in the state. There we go. SOAR works.
Yeah.
Thank you, Dennis. We've got community engagement coordinators going around to different reentry councils around the state as well, events around the state as well. So, Chairman, that concludes the well care.
Thank you, sir.
Steve, before you move on to
Yeah.
the next agenda item, I just wanted to hop in and say a couple of things related to the birth certificates for at no cost for people experiencing homelessness. This was thanks to the passage of House Bill 100, and it was one of our priority pieces of legislation for this session. So we were really glad to see that it passed. And I would encourage folks who are interested in making use of this law to reach out to the Department for Vital Statistics, because they are interested, like they want to implement this. We held a training back in August. If you need a training, just send me an email and I'll be happy to get the materials to you. And I'm glad to hear about the collaboration between DOC and Vital Statistics. And then secondly, with the SOAR, I just want to be clear, like that is, you know, to help increase income for people who are housing insecure and stuff like that. I don't want to say, I just want to obviously we want to increase income when people qualify for it. It's a way to try to get Social Security applications through faster and with a better approval rating. But I want to remind folks on this call that the amount of SSI or SSDI is not even reaching what a one-bedroom apartment costs in every county in this Commonwealth. So you know me, I'm always the harbinger of good news.
No, it's good. It's good information to know. It's SSI, SSDI, you know, it's a piece, but not the solution, right?
Yep, it's a piece. If I send out that training material, I am going to put my email in the chat, but if I send that to you, Steve, or you, Aaron, like, can you send it out to the group?
Mm-hmm.
Okay, I will send it to you both.
Yeah.
All right, and then I've got it.
Already asked for it.
Yeah, I know. That's why I'm like, okay. And that way everybody has it. And I've got to host a 10 o'clock meeting that I'm now 1 minute late for. So I will catch you all later.
Thank you, Adrian.
All right, thanks. Bye.
All right. Always include, and there's Adrian's Bush at hhck.org in the chat, Adrian Bush. I keep it on the agenda, Medicaid eligibility post-release. Someday this will no longer be an issue. Then we can take it off. I have not heard anything about that. If, you know, folks are still on, it hasn't come across my way recently. Are there any legislative updates? Okay. I keep it on here. You're interested, we can send out a link to the Kentucky Judicial Commission on Mental Health. Really substitutes an IDD, but KJCMH is long enough. They now have a reentry work group. I think it kind of partners well with this work group. If you're interested in participating in that, you can reach out to maybe Aaron if you have her email or mine, and we can let you know when that meeting takes place, when the next one's going to occur. I think it's worthwhile hearing about what they're looking at as well to move forward. So, in future agenda items, we will have Kristen and DOC on our November agenda, and we'll reach out to DJJ. Maybe Van, you can help coordinate that for maybe a January agenda. We always have recommendations. I don't think we have any. I think we're making good progress. I've said it before, we're moving away from talking about what this looks like to how to operationalize it. And I think that's pretty significant.
Real quick, Steve, before we lose anybody else, Monday, September 16th, recovery rally on the south lawn of the Capitol. Speakers start at 10:30.
This coming Monday at the Capitol.
Yes, sir.
Fan, this is Erin. I'll be there, so I hope to get to meet you in person.
All right, I'll be there.
Yeah, try to get there. It's 10:30, right, man?
Yes.
Speakers. Anybody else? Anything to share before we wrap up? Just be prepared. Maybe November might go a little bit longer than an hour, but that'll probably be okay. And thank you, Kadaka Sultana. Has her email in here or his email in here? Appreciate that. All right. Thank you all. Good meeting. See you. Take care.
Have a great Thursday.
Bye-bye.